Okay. Hey, Pixie. Thank you for the question. She says, my child's doctor recommends hydroxyurea for my 6-month-old son. What are your thoughts? So first and foremost, thank you for asking and entrusting me to give you um, the best answer that I can. So first and foremost, hydroxyurea is a low dose oral chemotherapy that has been on the market for decades. Um, it's been specifically approved by the FDA for sickle cell for 30 years or so. I've been taking it on and off since 1998. Um, So just to give you an idea of how long it's been around. Um, the main purpose of hydroxyurea uh, for sickle cell patients, there's actually two. So first and foremost, it actually helps the body to produce fetal hemoglobin. Fetal hemoglobin is the hemoglobin you have when you are a baby up until somewhere between 4 and 6 years old, when your body replaces something like 95% of the fetal hemoglobin with adult hemoglobin. Okay, so just to give you guys an understanding, fetal hemoglobin does not sickle. Adult hemoglobin does sickle. If you don't have the sickling fetal hemoglobin in your body, then you're not going to be subjected to the lack of circulation, lack of oxygen, um, the poisonous iron molecule heme floating around in your system. And then, therefore, those blockages that are really the foundation of sickle cell and all of its problems, but specifically the Vasp-Occlusive Crisis. Um, and this is the reason why when babies with sickle cell, um, you don't really see a lot of them going into like severe crises. You will see dactylitis, which is swollen hand and feet syndrome. Some children will go into crises. I did at about 6 months. And this is because the body is making the adult hemoglobin. It's just that it's not until somewhere between 4 and 6 that the adult hemoglobin significantly outnumbers the fetal hemoglobin, and now you're dealing with those major problems, complications, and ultimately hospitalizations that come with sickle cell. Hydroxyurea, however, does not push the body to produce um, a great deal of fetal hemoglobin. Like, you're not going to produce enough of it to get you back to that stage when you are a baby, where your fetal hemoglobin outnumbered your adult hemoglobin. Okay, that's part one. Part two, really what hydroxyurea does is it protects the organs. Okay, so ultimately what this is a preventative medication. You're not going to see it doing a whole lot in the immediate, future, or in the present, as you would a pain medication, or even Indari. You're not going to feel it working. You're still going to have complications from sickle cell, but in the end, it really does protect the organs. And so we say that it protects the body from end organ failure or damage, specifically when it comes to your spleen and the renal system. And just to give you all an idea, I did bust out my trusty sickle cell text. If you do not have one and you are a patient, a caregiver, or a medical professional, please, y'all, it's Christmas. Do the sickle cell patient in your life a favor. Go buy this book on Amazon. It's like $127. Do them the favor of educating yourselves and understanding this illness, because it's so much more than, oh, the cells change shape and then they have pain. No. But back to the 6-month-old. So in the book on page 470, yeah, I'm giving you the page. They talk about hydroxyurea therapy as a disease-modifying agent, and specifically the approval that came from the FDA. And the clinical trials showed that there was a significantly reduced number of vaso-occlusive pain crises, incidence of acute chest syndrome, and transfusion requirements into 299 adults that participated in clinical trial. And that ultimately these people had an improved quality of life, which is the goal, right? And it says that the clinical trial known as Baby Hug was designed to address the efficacy of Hydrea in preventing organ damage in very young children, and that basically the primary outcomes, which were the preservation of the spleen and the renal function, um, were not very different between the groups, um, meaning the adults and the children. Um, However, they did see the same significant reduction in acute chest, Vasp-Occlusive Crisis, swollen hand and feet syndrome, transfusion requirements, and the children tolerated it well, with toxicity being limited, um, and without increased risk to serious infection. And this was in 2017. Just to give you an idea of what I mean by hydroxyurea protects your organs from end organ failure and or damage, this picture right here, these are your kidneys. This is, yeah, these are your kidneys. The one over here that's looking like it's a piece of a leafy lettuce about to go on a very expensive salad, that's what your kidneys should look like. Those little ripples that you see, that's the filtering system of the kidneys. They're called tubules. Okay, and that's what filters all the stuff that the body needs to get rid of. This picture you see on the other side, that's your kidneys after sickle cell. Notice how it went from looking like fancy ass lettuce to old cauliflower? That is the damage that sickle cell does. And hydroxyurea helps to prevent that damage. So I hope that this visual and everything else that I've said will help you make a decision. And good luck to you.